I think most people would agree that when you look at patients with a mild PCO when they have a diffractive lens, we tend to do YAGs early because that mild PCO can really impact their visual acuity. However, I have found personally that it acts a lot like a monofocal lens. And even if the patient has a mild PCO, I don't find that patients really need a YAG. So I think actually for me, the incidence of needing to do a YAG after multifocal implant with a ClearView seems less actually than your traditional diffractive multifocal.
In our practice, we have not experienced any PCO in the 6 months that I've started implanting them, and we see the patients back 1 month, 3 months, 6 months after cataract surgery, and the vision's not fallen off yet. So I think it's important surgeons to polish the posterior capsule, clean off the lens epithelial cells on the anterior capsule, and thus the design of the lens is going to do what it does to prevent that PCO to occur. So it's been a clear lens. It's stayed clear for us in the 6 months that we've had it, and the patients have been extremely satisfied.
It is not uncommon. I'd say probably something like 1 out of 2 patients, we will notice that there are some visually significant posterior capsular opacity within the first couple, 2-3 months. Just like any other multifocal lens, posterior capsular opacity is particularly disturbing when you have a more complex IOL technology. So we have a low threshold to offer YAG for these patients when they are past the 4 to 6 week mark, because we want them to enjoy the best vision that they can have. So I will particularly warn my patients that posterior capsular opacity is a possibility, and really to normalize it so that they don't feel like something went wrong, that something is not going well. And I'll explain that the YAG laser is easy and safe and painless and quick and successful. And so if that comes up, which it does about half the time, where they have some PCO that is visually significant, they're not panicking. They don't think they're some abnormal case. They'll say, oh, I remember you telling me that. I remember you saying this could happen. And then it's a much more comfortable conversation. And then of course, once they have the YAG, they're thrilled because they notice their vision improvement.
So one of the other concerns with any hydrophilic acrylic lens is the high rate of posterior capsular opacification. At least that's what happened with the earlier hydrophilic lenses we had experience with. But I repeat, this really is a different kind of hydrophilic acrylic material. In the 1.5 years that I've been using these lenses, I have not one patient who has needed a YAG. Conversely, I've had patients with hydrophobic acrylic material, and I've had to YAG them within 6 months. So I've been very pleased with the lack of need for early intervention with PCO.
A posterior capsular opacification I see no more than other lenses, and frankly maybe a bit less. The few I've had to do so far have been easy, like any other would be. It's just the same routines you'd use for other hydrophilic or phobic lenses.
So in over 8 million implants, there's been 0.0003% reported rate of incidence of calcifications with this lens, which is exceedingly low. And I think that's something that's not really understood nowadays by most of our surgeons, is that the hydrophilic material of today's day and age is different than that coming from the past. So just like in preparation for any premium lens, I absolutely polish the capsular bag. Occasionally patients do need YAG capsulotomy, but in my experience, it's no higher or lower than with any other lens.
I have not seen at this time posterior capsular opacity. I have not seen that increase rate. But there's also things at the time. Our doctors cleaning their capsule well, doing capsular cleaning beforehand. But if I just took a regular monofocal or other type lens or other type lens material, I have not noticed a difference in needing YAG capsulotomies. And I have patients 7 years out who I've seen now, and they still haven't had a PCO.
I've been doing it for about a year now, and I think we haven't had to YAG any patient yet. So our rate of YAG capsulotomy is really low. Not that much different than other lenses, maybe because we're polishing the capsule, or maybe because it's the way the lens is, I'm not quite sure. But so far I haven't had to YAG any patient yet. When we work with other hydrophilic lenses, we do know that the rate of capsule opacity sometimes is higher. The fact that I polish the capsule at the end of the case, it seems to mitigate the rate of posterior capsule opacity quite a bit.
So because of the material of the ClearView 3, it's a hydrophilic acrylic material, it is prone to earlier PCO formation, and that's important in the early post-op assessment. So sometimes your patients will notice a little blurring of their vision, and you might usually attribute that to the lens itself, but actually if you look closely, they develop a haze of their posterior capsule relatively early in some cases. And so one way to decrease that is I like to polish all of my cases very aggressively under the anterior capsule, the posterior capsule, to delay that PCO formation. And even if you do find PCO formation, I mean, it's very easy to treat. So I've had patients present with a visually significant PCO. I was confident that that's what was causing their visual symptoms. I like to make sure that the lens is also centered before proceeding with the YAG. Once I decide that the IOL looks perfectly positioned, I proceed with the YAG capsulotomy as usual. All of my patients have had a resolution of their symptoms after the YAG. So I would say don't be afraid to perform a YAG laser capsulotomy earlier than you normally would. That's expected with this lens. But I do advise, making sure that you check the centration to make sure that's not the issue and that you don't need to address that before YAGing.